Hi everyone, this is Alina, and today I'll be talking about a episode from a series that I watched and about non-verbal communications. For today's project, I chose to watch an episode from Grey's Anatomy. I always enjoyed the show, especially the earliest seasons, so now I'm rewatching it. And the episode from today, there were multiple cases happening at once. In the neurology department, there was Justine, who had postponed her aneurysm surgery for a long time now because she's a writer and she doesn't want to go into surgery before she finishes her novel, being at risk of dying on the table. On the other case, there's a patient who is the mother of a former resident at the hospital who passed away. First impression, I think it's always important, but especially in like doctors, surgeons, their white coats, their scrubs, their entire appearance expresses their confidence in their skills. So a patient would be reassured of that entire appearance of the person that will be cutting them up. Justine's athletics are absent at first because she's completely ignoring her doctor. She doesn't make any eye contact. This kind of changes when she finally comprehends that one of her aneurysm had leaked and she's at risk of dying. Her facial expressions show first sadness, but then we can see her stubbornness of not accepting the surgery before she finishes her book. um, then we can actually see kinesis as well because she's sending away her doctor by gesticulating her hands. On the other hand, in the general surgery department, the patient is known by all the doctors, the residents, the interns. So when the assigned staff comes into the room, you can tell that they all know each other and they care about each other. Haptics come into place when they start hugging, and then their voice pitch becomes really high. Also, their voice volume it's raising. All these are examples of vocalics. The resident from the neuro case is trying to convince her patient that surgery is her best options. Affective displays come into place now because she's using facial expressions, gesticulations to change her patient's mind. I could see that her rhythm in her voice started to change because she was trying to express compassion, care, good intentions because the resident wanted what's best for her patient. Later, the patient actually started to have a seizure. So you could see that in the resident's voice was a big change. Her rate started to increase dramatically, and she was really loud because she was trying to get the surgeon paged. All of this expressed the seriousness of the situation and that every second that it's wasted matters. In the case of the patient in a general surgery department, next she was giving the news after some tests were run that it's just a simple procedure and everything is gonna be okay. Because the doctor gave her the news with a smile and a warm handhold, she felt safe and she knew that everything is gonna be okay. Those micro expressions reinforced the words of the doctor. Both patients were taken to the OR in time, and the outcome was successful for both of them. When the patients came out from the anesthesia, their facial expressions showed relief, gratitude, and happiness. These examples from the episode that I watched show me how important it is to use nonverbal communication in junction with actually words. Even if the series it's fiction, we for sure can apply in real life all these examples. That will be all. Thank you.